Hey guys, today I wanted to make a short video about laboratory work or lab orders that I would and do order if someone is coming in with anhedonia, which is technically the decreased ability or the inability to experience pleasure, but that definition doesn't really encapsulate what people with anhedonia actually feel like. People with anhedonia usually feel little to no positive emotion of any type. So, they don't feel excitement or like joyful anticipation about things. They don't feel like life is meaningful. It's essentially a severe form of boredom that makes life feel gray and purposeless. So, overall, anhedonia is a severely under-neglected topic in psychiatry and in modern medicine in general. Psychiatrists rarely ask about it specifically, even though it is a core feature of depression. You either have to have low mood or you have to have anhedonia, okay? And then there's other auxiliary criteria for like major depressive disorder, for example. But for being a core symptom of depression, I'm always startled at how little attention it gets, especially with how life-destroying it can be. So the reason I mention this, and this is kind of a disclaimer for all of the anhedonia videos I do, or any like books or courses that I come out in the future, both of which are goals of mine to do if I eventually have the time. That's kind of the disclaimer I give though with anhedonia is a lot of this is doing the best we can with the scientific literature that we have. And so keep that in mind when we're discussing like blood work that can be done to try to investigate if there's any, organic causes or contributors to anhedonia. But anyways, let's get into it. Let me just list off the ones that I order, and then we can talk about them a little bit more in depth. So, vitamin D, a CBC, or a complete blood count, a CRP, which is a C-reactive protein, and then if you're a man, testosterone, 100%. So let's talk about all of these a little bit more in depth. Each of these could have its own 20-minute video probably, so maybe eventually we'll break this down even more. So vitamin D is exquisitely common, at least where I practice. I'm a psychiatrist in Montana. I've tested, at least 500 or 600 patients for their vitamin D levels. And this goes from like testing 5-6-year-olds when I was in training, when I was working on the inpatient youth unit for psychiatry, all the way up to people in their 90s. And so what I have found in Montana, at least, and I'm guessing this is true for large swaths of the United States or anywhere in the world that's significantly like high up compared to the equator. But like Montana and other northern states, this is a serious problem. So out of the 500-600 plus patients that I've tested for vitamin D, I can count on one or two hands, literally, how many patients that I've tested that did not have a vitamin D deficiency that were not supplementing with vitamin D, either with a multivitamin or just, standalone vitamin D capsules. This is like epidemic proportion problem in Montana, at least. Almost everyone has a vitamin D deficiency here that is not supplementing. In fact, when I don't see someone with a vitamin D deficiency, when I test their blood, I assume with great confidence that they are taking vitamin D, in a pill form. So low vitamin D has been associated with anxiety and depression through various studies for many years. Not all of the studies are consistent in their findings, but generally low vitamin D is routinely associated with depression. And of course, the question of causation versus correlation is important. People that are depressed are less likely to go outside to get the ultraviolet radiation from the sun. They're less likely to have a nutritional diet. They're less likely to care about their health enough to take vitamin D since they're depressed and they're apathetic and anhedonic. But low vitamin D is definitely something that I see a lot of in my patients, and this is going more off of clinical experience, of which I have a lot of when it comes to finding and then correcting a vitamin D deficiency. What I find personally is that when a patient comes in with low vitamin D, which is anything under 30, in my experience, if someone has like a vitamin D of like 20 or under or so, and I correct it for them, what they usually describe, if they feel anything, is a increase in energy, so fatigue can substantially improve or go away, and they report a lot less apathy. They just have energy to do things, and a lot of patients, when you dig into it, will essentially say that they're just more interested in hobbies, daily activities, have less dread attached to them. This is really important because they're essentially describing what anhedonia is. So this is something that I think is really important if someone is emotionally numb or anhedonic. Really important, I think, to check vitamin D levels and correct them. Now, as a doctor, I can prescribe prescription strength vitamin D. So I can correct a vitamin D deficiency extremely quickly within like 2 weeks using 50,000 international unit capsules twice weekly. So, if you have a vitamin D of like 20, you can get it up to 30 within like the third or fourth pill usually, especially if you take it with a fatty meal. Vitamins A, D, E, and K are going to be best absorbed if you have fat in your stomach at the same time. So yeah, I'm convinced that low vitamin D contributes to apathy, low energy, and by the way, apathy and anhedonia, very strongly related, but you can have anhedonia without apathy, and you can have apathy without anhedonia, but they're often hand in hand. And anhedonia can definitely cause apathy. If your reward circuitry is not working properly, then that's definitely going to be an issue. So vitamin D. The next one is CBC. A complete blood count will test for white blood cells, which can be important if someone has an infection or they're going through some sort of viral illness, or it's also used to screen certain types of cancers. When it comes to anhedonia, though, in a CBC, what I'm really looking for is the amount of hemoglobin that they have in their red blood cells. You can also just look at the hematocrit. The hematocrit, the hemoglobin, and red blood cells, if those are low, then that is pointing to an anemia. And the most common cause of anemia is going to be iron deficiency, but vitamin B12 and folate can also cause an anemia. So if you have anemia, your hemoglobin, hematocrit, and red blood cell count are going to be decreased. There's a lot of different values to a CBC when it comes to looking for anemia. The MCV, mean corpuscular volume, Gosh, this is going back to first year of med school. I think I said that right. The MCV is really important. So if the MCV is low, that's suggestive of an iron deficiency. And if it's high, that's suggestive of a vitamin B12 or folate deficiency. RDW can also be elevated if you have an anemia. But those are the ones that can really help tip a clinician off if someone needs more workup past that. So like, let's say their hemoglobin, their hematocrit, red blood cells are low. The next thing I would do is get an iron panel, not just serum iron. You want to get a panel that's going to have like ferritin, TIBC, transferrin. These are all important values to really try to understand if they have an iron deficiency. And but you might also want to get a vitamin B12 and or folate too. Usually when I'm getting a B12, I'll order it as B12 and folate. They're both important to check if someone has anemia. The issue with B12 is that blood levels of B12, serum B12, is not an accurate way to necessarily detect a B12 deficiency. If your B12 levels, like through the blood test, are low, then that means that they're low. If they're normal, though, that doesn't necessarily mean that you don't have a B12 deficiency. So you can get a homocysteine. That's important for all sorts of things. It can tell you what your risk is for things like heart attack and stroke. But the most accurate way to test for a vitamin B12 deficiency is going to be getting a methylmalonic acid. So yeah, vitamin B12 is going to be common in those that follow a vegetarian or vegan diet, those that have suppressed acid, or maybe they're taking a proton pump inhibitor like omeprazole, Nexium, Prilosec. It can even happen with the other types of acid blockers like famotidine, but PPIs are classically a culprit for a B12 deficiency. And also, as people age, the amount of acid that their stomach cells produce is going to be lower, and hence a vitamin B12 deficiency is pretty common in elderly patients. So, low iron, low B12, low folate are all associated with depressive disorders. So those would be important to look into if someone has anhedonia. So we've talked about the vitamin D, the CBC, and then any other labs if the CBC suggests anemia. And then CRP. I'm going to have like a whole battery of videos about CRP and inflammation. So C-reactive protein is just a general marker of inflammation. It's very cheap to order. It's just a blood draw. And studies have kind of correlated blood levels of CRP with inflammatory markers in the central nervous system. So they've compared blood CRP levels to inflammatory markers in the cerebrospinal fluid of people that have gotten a spinal tap or a lumbar puncture. The correlation is really strong. So if your CRP is elevated, it's over 1, that's pretty darn strong evidence that your brain is also inflamed. And brain inflammation absolutely causes and contributes to anhedonia. There's various avenues of research showing this. If your brain is inflamed, the amount of dopamine being released from vesicles that would be dumped into your synapses are going to be reduced, so it reduces the amount of dopamine availability. Inflammation also functionally disconnects the reward circuitry from your brain from the rest of your conscious brain. So even if you have a healthy reward system in your brain, inflammation will decrease the amount of neural activity to and from the nucleus accumbens, the ventral striatum. So brain inflammation, and just think about it. Last time that you had like the flu or COVID or something, did you feel like doing much? Did you have the motivation to do anything? No, of course not. You feel fatigued, apathetic. You feel kind of just emotionally zombified. Okay, this is what brain inflammation does, and this is such a neglected topic in psychiatry. So if someone has anhedonia, I will always check a CRP to ask the question, could someone's brain inflammation be contributing to their emotional flatness? The last one is for men, testosterone. So the studies on anhedonia, specifically in testosterone, are scant, like the others I've talked about. There was one interesting study that showed that testosterone can prevent but not treat anhedonia. I'm not sure how to take that one. Here's the thing. Low testosterone in men cause classic depressive symptoms: apathy, low mood, low motivation. I have a very hard time believing that correcting a testosterone deficiency would not potentially help someone's anhedonia. If someone's anhedonia is being caused by low testosterone, then obviously correcting it should improve or completely remove the anhedonia. But just as like a indirect course towards anhedonia, if someone has low testosterone, their motivation to do like any hobbies or activities that would give them pleasure is going to be so low that it will indirectly, cause the emotional flatness and disinterest in activities that you see with anhedonic patients. So those are the main labs: vitamin D, CBC. If the CBC is off, you might have to get an iron panel. You might want to get a B12 and folate / methylmalonic acid or homocysteine. And then getting a total testosterone can be really important in men with anhedonia and depression symptoms in general. And I'll go into further in further videos. I'll talk about like free versus total testosterone. Usually, we start with a total testosterone. You also want to know how much testosterone is bound to protein. So, but yeah, total testosterone is still kind of the standard for at least screening for low testosterone. So there are other labs that can be considered if someone has anhedonia. Those are the big ones though. Keep in mind, guys, that there are all sorts of causes for anhedonia. In my personal opinion and in my clinical experience, chronic stress and anxiety is the #1 cause of anhedonia. If you have generalized anxiety disorder, PTSD, unresolved childhood trauma, OCD, if you're just chronically stressed, that is going to be a huge risk for anhedonia. And if someone's anhedonia is caused by anxiety, the anhedonia is probably not going to go away until the anxiety or the trauma that you have has been resolved. And after the anxiety is under good control or it's managed, it can take months for the anhedonia to improve. And of course, you have to think of other things too. Is your sleep crap? Do you have obstructive sleep apnea? Like if you're overweight or morbidly obese and you snore a lot, there's a very high chance that that kind of rhetorical patient might have sleep apnea. And of course, there's other things that I look for as well with anhedonia. But anyways, those are the labs that I would start with. Also, I'm not recommending that you do any of this yourself. None of this, of course, in this video is medical advice. But I do want to mention that in the vast majority of the states in the US, you can order your own lab work online without a doctor's prescription. And it's usually pretty affordable. Walkinlab.com is the one that I personally use, but there's other services too. And essentially you choose whatever lab you want to get. You pay for it. So like a CRP is probably like $35. A vitamin D might be $30 kind of thing. CBC might be $20. But you essentially pay for these. You decide if you want to do it through LabCorp or Quest. There are LabCorps and Quest labs everywhere. Like, if you've never heard of these, I can almost guarantee you that there's at least one of those labs within a 10-mile radius of where you live, almost guaranteed. And if you live in a metropolitan area or a city that has like at least 50, 100,000 people, I can almost guarantee you that you have a lab that you can go to. So essentially with like walk-in lab, you choose the labs you want to get, you pay for them, you decide if you want the labs to be sent to LabCorp request, and that's it. And then you usually, you can schedule an appointment if you want, but with most of these, you can just do walk-ins. In my experience, they don't even need any paperwork because it's all sent electronically. So once you pay for it, you just show up, you get your blood work done. And once those are processed through their lab, then the online service that you use, like Walk-in Lab, will email you once the results are back, and then you log into your portal. So yeah, I'm a huge fan of patients having the freedom and the liberty to investigate their own health. I think that's an important, I think that's just a really important freedom that anyone should have. So again, I recommend all of this be done under the supervision of a doctor. I've got to give that disclaimer. But anyways, it's good to see you guys. I'm hoping the audio is better now. I bought this little microphone, and I hope to make more videos soon. Actually, I might make a video later today just talking about kind of my dreams and my goals for this channel and just my overall goals as a psychiatrist, and how I don't just want to work like a 50-hour a week kind of job, seeing patients every 30 minutes. I want to spend more time with you guys making videos. I want to get my website back up and running. I want to make like online courses that are affordable. I want to make books, and I hear you guys, all of my anhedonic subscribers, I hear you guys. I'm one of, I think, the only doctors that are really spearheading this debilitating symptom that people have, and I care about you guys a lot, and I want to make more and more, I want to make more and more content. It's just really hard with all of the responsibilities and my like full-time job. Anyways, I digress. I'll talk about that later, but I've got to find ways to so I can spend more time with you guys and make more stuff. So, all right. Peace out.